My name is Paul Cromhout and I'm the head of the Small Projects Foundation, which is a provincial implementing agent for the Community Work Program in the Eastern Cape. We are busy running a program which is creating employment for people, but providing really improved services for communities across the municipalities of the Eastern Cape. We're aiming specifically at building the capacity of these previously unemployed people in primary health care, in providing improved education and keeping girls at school, and thirdly, in helping orphans and vulnerable children and women and children who've been sexually abused. With these employed workers who are employed under this job creation program, we are now able to provide both these workers with a future and a hope, as well as improve the services to each village and each family in these villages on an ongoing basis. We're very excited about this program, and we're hoping that it's going to be able to be replicated throughout the provinces of South Africa.
Four of the biggest challenges facing South Africa are HIV, AIDS and TB, unemployment and education, abuse of orphans and vulnerable children and women, and local government service delivery. The Small Projects Foundation has embarked on a systemic program that aims to change lives of poor communities in the 10 municipalities of Alfred Nzo and OR Tambo district municipalities. Firstly, it has developed a simple participatory ward planning initiative in which communities and councillors identify needs, prioritise these needs, develop action plans, and, using community work participants, put plans into action. This program leads to quick action by communities, councillors and stakeholders to improve the lives of communities and build participatory democracy in action. From this foundation, communities, local authorities and stakeholders have identified the following crucial needs which have been developed into key programs. 1. Primary health care service improvement. Improved primary health care and access to health services is an urgent need that has been exacerbated by the HIV, AIDS and TB epidemics in South Africa. The Small Projects Foundation has trained and employed 400 community work participants per municipality in primary health care and HIV, AIDS and TB work. These lay community health workers can now cover almost every village and bring health education, counselling, referral and follow-up to families in the most disadvantaged villages. The program is also training clinic committee members as health monitors to ensure improved clinic services and accountability, and uses a balanced scorecard for clinic service improvement. This program offers a way to ensure prevention of HIV/AIDS, especially mother-to-child transmission of HIV, decreased maternal and child mortality, improved treatment and adherence to treatment for HIV/AIDS, TB and chronic diseases, and a strengthened primary health care system. These community work program workers are trained in National Department of Health approved skills and will be available for appointment when Department of Health posts become available. 2. The Bright Futures Program. Next up is a program that addresses empowerment of girls and vulnerable children to complete secondary school. This program has trained 400 community work participants per municipality to assist schools in training girls, teachers and parents in puberty and sexual and reproductive health education, supporting girls to complete school, and ensuring toilet and school facilities are maintained. These participant workers are trained as peer educators and learner support agents, and also help and support learners through Bright Futures Clubs to learn skills to find or create their own jobs after completing school. 3. Social support for women and children. This program has trained 200 community work program workers per municipality to work in communities to create child and women care forums to provide a social safety net for vulnerable and abused women and children. These workers provide rights education, surveys of orphans and vulnerable children, home visits, support group establishment and maintenance, referral and gardening training to vulnerable groups and survivors. These initiatives have already made a significant impact in the lives of patients, families, communities, and at a municipal level. The program provides useful work, improves the lives and futures of patients, schoolgirls, vulnerable women and children, and strengthens services to communities. It has given unemployed people self-respect and a living while improving the lives of community members. The program puts hope into action and creates a future for previously unemployed people and their families.